Hey, guess what? Exclusive. The federal government is tracking unvaccinated people who go to the doctor and to the hospice due to the CDC designed surveillance program. Are you kidding? The U.S. federal government is tracking people who decided not to get the COVID-19 vaccine injection, according to bombshell federal government records and video exclusively obtained by National File. According to this shocking video, unvaccinated people are quietly tracked when they go to the doctor's office or to the hospital to a quiet new program proposed and implemented by the Centers for Disease Control and Prevention. Oh, they're being quietly tracked? You know, like a stalker outside your window, quietly jerking off. It's like that, but way worse. So here's that video that they're talking about. Listen to this.
For people who are immunized, but there has been interest expressed.
So look what it. So this is where we start off. During the time of this pandemic, with COVID-19, people have now been having immunizations for a number of months, and these provide protection for people who are immunized. Wait, not immunized or partially immunized? So they are tracking everyone, is what you're saying? Since the vaccine does not actually confer immunity, even though it does slow the spread and is totally safe.
For people who are immunized, but there has been interest expressed in being able to track people who are not immunized or who are only partially immunized. And at the current time, there can be considered to be a significant modifiable risk factor for morbidity and for mortality, and it can be of interest for clinical reasons as well as being of value for public health reasons to be able to track this. NCHS is therefore proposing creation of codes related to people being unvaccinated for COVID-19. And
so they're creating codes. So your doctor has to put in a code that lets everybody know you're unvaccinated or partially vaccinated, or as they were using the term immunized, which I think is a dumb term for them to use for this. But I'm certainly dumber than them, right?
Being partially vaccinated for COVID-19. This is proposed for early implementation on April 1, 2022. Therefore, comments are requested by October 15 of 2021. That would be approximately 1 month from now. Just to look at how this would fit and where we would locate it in the classification. We're looking at the tabular modifications being proposed here. We have a category Z28, immunization not carried out and under immunization status. Z28.3 is under immunization status. We would propose to create a new subcategory Z28.31 for under immunization for COVID-19 status. And within that, we would propose to create two codes, a Z28.310 for unvaccinated for COVID-19 and a Z28.311 for partially vaccinated for COVID-19.
So they created codes to track you. That's what this is. That's what they're saying. And then another one?
And then we would also create a additional new code, Z28.39 for other under immunization status, which would be used for the other current purposes that Z28.3 is being used for at this time. So those are the proposed changes. One question that might be asked is, what if someone just said under immunization for COVID-19? And I would propose we could index that to the Z28.311, although we do not show that in this. But I'd be interested in comments on that also.
So there you go. So that was a government meeting. Government meeting materials make clear that the new program is designed to track people who are not immunized or only partly immunized. A bombshell piece of information was revealed at the September 14th and 15th, 2021 virtual Zoom meeting of the federal government's ICD-10 Coordination and Maintenance Committee. That's what that video was from, which includes representatives from the Centers for Medicare and Medicaid Services, known as CMS, and the Centers for Disease Control and Prevention, known as the CDC, National Center for Health Statistics. At the meeting, the committee discussed new categories of ICD-10 codes that the CDC's National Center for Health Statistics wanted to create to mark people as unvaccinated for COVID-19, partially vaccinated for COVID-19, and other under immunization status. I hope they're also sharing this immunization data with car insurance companies, because I was told that people who don't get immunized are certainly, they drive like assholes. The ICD-10 coding system was created by the World Health Organization, being funded by Bill Gates, who's a thug. And the doctors are required to use it to categorize different kinds of patients. The ICD-10 codes are preserved in a patient's electronic health record and used by insurance companies for billing purposes. Hey, I know. Why not just tattoo their status on them at a camp? The CDC's National Center for Health Statistics maintains the ICD-10 codes. Within ICD-10 codes, there is a category known as ICD-10-CM, which are reportedly used by the CDC for tracking purposes, and this CM category includes the new unvaccinated for COVID-19 category, and also the partially vaccinated for COVID-19 category, and the other under immunization status category. Hey, that reminds me, I'm super worried China could be using our data they collect through TikTok. And I mean, can you imagine how evil it would be if China tracked us through TikTok? Not the good kind of tracking like this with COVID, I mean. The committee made it clear that the new codes would be used to track unvaccinated people. Just imagine if they put this kind of... Anyway. The CDC implemented the new codes to track unvaccinated people in April 2022, according to the document published on the CMS federal government website. ICD-10 Coordination and Maintenance Committee staffer David Berglund, MD, read from page 194 of a CDC topic packet that was prepared for the meeting. The topic packet states, emphasis added, during the current time of the COVID-19 pandemic, immunizations have provided protection for many people, but there is interest in being able to track people who are not immunized or partially immunized. That's what I just showed you on that video. At the current time, this is a significant modifiable risk factor for morbidity and mortality, and of interest for clinical reasons, as well as value for public health. NCHS is proposing creation of codes for... That's what I showed you. So there it is. They're tracking you. And big whoop, right? I just hope they don't do it on TikTok, because that would be bad. But this, I'm sure, is fantastic. I'm sure there's nothing wrong with it. And even though the CDC, the FDA, and the NIH are the biggest liars in history, I bet they're not lying, and they're not going to do anything nefarious with any of this. I bet it's for your health. I bet it's good. So you should shut up and just take it. Hey, we're doing live stand-up comedy in Los Angeles, Tempe, Arizona, Palm Springs, Milwaukee, Minneapolis, Nashville, Northampton, Massachusetts, and a lot more places. Go to jimmydore.com for a link for tickets and become a premium member while you're there. You get access to all of our stuff. See you then.